Hey everyone, OT Life Hacker here. I have the best news. Oh my gosh, guys, I got to see my first two patients. My first two patients, as in I led it and the OT was on the side just letting me work my action, and it was so cool. I got to plan it all, decide what we're gonna do for the treatment. So I'm gonna share with you tips for what can help ease the process when you see your first patient. So when the time that you see your first patient, what are some tips to make it easier for you and less nerve-wracking? So what I did, and also what I did, as well as mistakes that I made along the way. So first off, ask the patient if they have supplies. So by that I mean, if you want to do grooming, if you want to do brushing their teeth, washing their face, stuff like that, see if they already have their own toothbrush, their own face wash, their own toothpaste and shaver, hairbrush, all of that. Some people may bring their own, and some people may have their own, but that's more so if they have a planned admissions. So that's more so like people who have been waiting for surgery and had planned the surgery out, so they will bring their stuff. And you also want to set up the area before getting the patient up and to wherever you're going. So you want to have the supplies ready. You can go into the patient's room and ask them, do you have any toothpaste, toothbrush that you want to use to do your brushing your teeth with. Now, something that I've noticed, you'll notice for the different people that you work with, occupational therapists, everyone has their own way of doing things, whatever works best from them. And so you as the student are going to be learning from a lot of different styles, and you get to get that opportunity to see what works for you, which is so awesome, guys. It is so awesome because you get so many different perspectives and get to see, would I want to do it that way? Do I like the approach they're using? Do I want to have the room set up with all the equipment ahead of time so that if we get to this, we have everything? Because the caveat to that is, if you don't get to that, if the patient doesn't need that, especially during this current times, it's in their room now. It's exposed to them, especially if they get to look at it, then there's contact with it. So you essentially would probably want to leave it in the patient's room, even if they're not going to use it. And even if they have their own, then they're just going to have extra. And some people might appreciate that, others might not. So that's one of the challenges. If you bring everything there, the patients may not want it, or you may not be able to get to it. And then we have, so setting up the area means that you have your towels, your face towels, your hand towels, and your hairbrush, all the grooming supplies at the sink. And you also have the bed in clearance for you to bring the walker, if it's a four-wheel walker, to the sink, to the bathroom. And of course, you also want to be very savvy with the wires, know how to manage the wires and the tubes. And then if you have a gait belt, you can put the gait belt on the patient when you have them sitting up in bed. And so I didn't get to mention this sooner, but what I'm talking about now is acute care and occupational therapy. It is my 7th day. Woohoo! My 7th day, yay! It is my 7th day in occupational therapy in acute care, and it is on my 7th day, the mark of the 7th day, yoo-hoo, that I got to see on my own, essentially, the OT on the sidelines watching, supervising, that I got to do my first 2 on my own. Gosh, that was so awesome. And when you guys get to do that, it's gonna be incredible. You're gonna feel so much like an OT to be. Oh, I am so excited for you guys, even if you haven't started yet in your OT fieldworks. You guys are gonna be amazing when you get into it, especially if these videos especially if you are watching this video and are finding it helpful. That's gonna be so great. If you like this video, do give it a thumbs up, and also it helps the channel so much if you subscribe, and do feel free to share, comment below on what if you have anything that you want me to talk about for later future videos, and if you are in fieldwork, what your setting is like, and if you are a practicing occupational therapist, what it's like for you in your acute care setting, how you do things, because again, what I'm sharing with you is what I've seen, what I've come to find also works for me, or what I'm exploring. So do share your tips, because we are all learning from each other. This is a community for growth and learning, and also for anyone who has a loved one in the acute care setting. My heart goes out to you, because I imagine it is an incredibly tough time for you right now, having to not be able to visit your family. I feel for you. It's really hard, and I'm sure even the depth of my thinking I can relate for my own family members, loved ones, if they were in that situation, if I was in that situation with them. It is incredibly hard. I'm so sorry that you have to go through that. And also thank you for trying your best to work with the circumstances as they are. And then so we have turn off the bed alarm. So that's a good one. If you hear something start beeping at you as you're taking the patient out of bed or to the edge of the bed, that's probably because the bed alarm is on. So make sure that that is off before you take the patient out, and notice, pay attention to what setting it's on, because you're going to be putting that bed alarm back on at the end of your session. So also don't forget to turn that alarm back on after you're done with your patient. And then remember, so this is the last piece that I'm going to share with you, is the hardest part I had. And the hardest part is also because, again, for everyone who is in acute care right now, they are not able to see their family. It is incredibly hard for them to not have someone physically there to be a companion for them, to talk with, to have someone present with you. And so I truly feel for the patients, for the clients, that they're by themselves. They don't have physically someone there, even as much as the loved ones want to be there and are there with them by phone, by Skype or whatever virtual technology. It is really hard. Many patients, many people in general do want that companionship, want someone else there with them. And so it is so hard to try to redirect or to end a therapy session when you want to spend that, you want to spend that time with the person, but unfortunately or fortunately, you have so much, as a therapist, you have so much more to be doing with other, I mean, you have to be with other patients. You have to be there for others as well. So as much as you want to be with one person, spend as much time with them as you can, you have to remember that you have others to also see. So you want to also give care, provide that support to as many people as you can. And so remember that you are the one who you have your deadlines to meet, so that to see everyone, make sure that everyone is getting the right care that they need. And so always remember that, because it is, for me, it was really hard to part ways with the person that I was seeing. It was so lovely, and it's just, I absolutely love that about occupational therapy, is that one-on-one time. Again, I have the master's in public health, but one of the reasons I wanted to continue into occupational therapy is because of that one-on-one connection and being able to help a person on multiple levels that are holistic, that are helping with the environment, helping with the activity, helping with the person, having them all match, you know, the PEO model, everyone, person-centered, person, environment, occupation. For all the OT students out there, when you are practicing in your fieldwork, what model are you guys going to use? So you see the one I like to use. It is really hard to part ways, but you have to do it so that you can help others. Everyone can benefit from your support, and do as much as you can, of course, while also being very respectful of the need to help others as well. Alright, so that is the last part, is to remember if the person has any compression equipment, or has their IV, or has their heart monitors, anything that was attached and you detached, remember to always attach that again. And then put up the railings. In this facilities and in the other facilities I worked at, they had put up the railings with one knot up. So that indicates that, I mean, the purpose of that is to not be restraining the person from moving around in the bed. Some patients may ask you to put all of the railings up, and so of course you can do that, but just remember, follow the policies in your field work, in your setting, and it is okay to, I mean, I'm sure your fieldwork educator will also say this to you, and they will be there for the most part to give you that support. If they're not in the room, then you go to ask them questions. You make sure your patient is in a safe place, and make sure for example, one of the patients I was working with started to feel very tired because of the medication that she was taking, and so she started leaning on the counter, and so I had to take off the bed railing. So make sure you know how to take off the bed railing, because I had to take that off and then help her quickly to the bed to sit down, because there were chairs, but they were not within proximity to me and her, and I could not leave her, right? So for safety, the closest place, the best place for her was by the bed, which was a few feet away, but that was the best choice, and it worked out well. Alright, so that is everything for today. Thank you all for joining me. If you like this video, I want to see that thumbs up, please. Like this video if you do. And then do share this video with others, other occupational therapy students, others, and even in speech speech therapy and physical therapy, because honestly it is really, really good for us to all know each other's professions. And so I find it very useful to watch physical therapy and speech therapy videos, because I get to see the overlap and the differences between them, and in the different settings. It's all very, there's so much to learn. You'll always be learning. And that is it. All right, so talk to y'all later. Do share your comments below on what it's like in your setting. And also, again, last shout out to all of the people who are have family in the ICU. And even if you are a patient yourself and watching YouTube and come across this, my heart goes out to you. It is a really difficult time, and thank you for bearing through all of this. It is a crazy time, and we hope that it gets better. So again, for you, my heart goes out to you. Thank you, everyone, and see you all later. Bye bye.